Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by the award-winning quarterly journal AACN's Advanced Critical Care, with information available at www.aacn.org/advancedcc. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to the Voices in Nursing podcast. I am Dr. Vicki Good, Chief Clinical Officer, and I'm joined by my colleague and Clinical Practice Specialist, Andrea Schmidt.
Hi, welcome to today's episode.
Many people think that the AACN Healthy Work Environment Standards, or what we like to call HWE, are new. That is not the case. The HWE 6 standards are actually over 20 years old and were developed by a team of volunteers back in 2005. In the early 2000s, AACN recognized the need to address the health of the work environment. Multiple research studies have continued to show the positive impact of implementing the AACN HWE standards. Outcomes include lower rates of workplace violence, improved staff recruitment and retention, and lower rates of burnout, compassion fatigue, moral injury, and positive patient outcomes. Unfortunately, despite this evidence, we still see healthcare organizations that have not implemented the standards or struggle with the health of their work environment. That led AACN to seek out our guests who are experts at using a collaborative to implement widespread changes across an entire team. You may have heard of some of their pioneering work with the ABCDEF bundle. The National Collaborative, which we started, is made up of 135 diverse units across 45 hospitals spread across the United States. The multidisciplinary teams are on a 2-year journey working together to implement the HWE standards to impact nurse and patient outcomes. The amazing part of the collaborative is that they are all types of units working on a common goal, including medical surgical units, operating room, mother-baby, progressive care, emergency departments, and yes, of course, we have some ICUs. And the teams involve all disciplines. We have physicians, respiratory therapists, pharmacy, and nursing involved.
Thank you for that great introduction, Vicki. I'm really excited to introduce our guests today. Brenda Pun and Balas have partnered with the AACN advocacy team to address the challenge of implementing the HWE standards. But before we start learning more about this initiative, let's have our guests introduce themselves. So Brenda, would you start off with a brief introduction and tell us a little bit about yourself?
Happy to. Thanks for having me. My name is Brenda Pun, and I am at my core an ICU nurse, and I am the Director of Research Operations with Vanderbilt University Medical Center's Critical Illness, Brain Dysfunction, and Survivorship Center. And I'm happy to be a part of this team and help think through how do you get things really adopted at the bedside.
Michelle, would you introduce yourself?
Hi, everybody. I'm Michelle Balas. I am the Associate Dean of Research at the University of Nebraska Medical Center College of Nursing, obviously in the great state of Nebraska. Thrilled to be here and thrilled to be part of this amazing team that is transforming everyday critical care practice and acute care practice.
So I've been involved in quality improvement for many years of my career. I was counting it up the other day and I was like, oh, wow, that's a lot of years. So what makes the National Collaborative approach different than a standard quality improvement process or the standard PDSA? What's the secret sauce to this approach? Either one, just jump in.
I can jump in here, and Michelle can fill in my holes that I'll obviously leave. I think collaboratives are a really special thing in that they pull together a bunch of people that have been trying to do something, and they give them some more structure, some more education, and some more help in doing that. But they're really helping them to do what they want to do locally with some outside support. So just a little bit of support, putting up some support beams, some help, some structure, and they can run with it. And like you described earlier, Vicki, in a diversity of settings. So it's providing some structure and letting them be flexible and diverse in the implementation at the bedside, but providing that support that we all know is needed in our busy environments, that it's so hard to create that structure sometimes on our own and have all the right pieces in place to keep moving along and have somebody from the outside that's cheering you on and providing the next step or the next milestone for you. And I think that's part of the secret sauce. Michelle, what else do you think are the ingredients in that secret sauce?
I think that was beautifully stated. I think I'm gonna emphasize the bigness of a collaborative. Sometimes when we're doing local quality improvement projects, they're so important and they will always be an important part of quality work. But when you're in a collaborative, you are part of a much bigger group, almost like the Borg, right? You got all of these motivated sites who want to change practice, who want to deliver improvements in everyday care, and now you're putting them together. And the secret, I think, is really that learning that occurs through each other. Now, AACN has invested so much to make this collaborative successful in terms of resources and giving us the experts in the field and having that ability, to call up a leading expert and say, hey, I'm working on staffing. Do you have any ideas that we can do improving staffing? Do you have any ideas? You could, you have one of the leading experts in the country working on that. But it's the group working together, learning from each other, and being part of something that is going to have a huge and major impact. And I think it's the passion and the talent that all of the collaborative members bring to the table. That's really, if you're looking for the secret sauce, it really is the people that are participating in it.
Yeah, and I think the shared the sharing that happens, within the teams is just so incredibly valuable because there's not a competition. Everybody is in it to win. And so they're all trying to get everybody across the finish line.
It's funny that you bring that up, Vicki, because I sometimes say when I talk about the benefits of a collaborative is actually sometimes is the competition. So when we worked with the previous collaborative, there would be that innate competition that comes between groups, that everybody wanting to do a little bit more, a little bit better than someone else. You have like a historic rivalry, like the Ohio State and Michigan, and they're both working on, say, the ABCDF bundle. Well, one of them wants their SAT rates to be better than the other. So competition isn't necessarily a bad thing per se. It sometimes actually does spur a lot of innovation as well.
Yeah, little healthy competition goes a long way.
Brenda, I really liked what you said about how the collaborative is, provides the structure. And I think about that foundational support. And so when I think about that, I love the fact that, you are providing that support so that when the collaborative is over, they're still able to do and continue on with work and make changes and continue that health and maybe share it with new people as they onboard on all the various teams. So what I'm curious about, and I'm hoping you can describe for our audience, either one of you, what does a typical healthy work environment collaborative meeting look like when you have all of these people? How do you guide the teams during this work?
Well, I think it's important first to realize there are different types of meetings that are happening in the collaborative. And so there are large group meetings, which is the whole team getting together. So all of those units, 135 units that Vicki described earlier, are on one session together, and those are usually content driven. So those are contents about healthy work environment or about quality improvement, because we think both need to happen, getting that education, skills, and training for both of those things. And then there are also some small group meetings, and those are regional driven. And so that's where the collaboration part comes in. And so in those small group meetings, in those regional meetings, that's where different hospitals within a region get to a smaller group is on, and they are learning from one another around that topic. So it's sharing a little bit of, hey, we tried this and it worked, or here's this tough nut that we just can't crack. Like we can't get past this one hurdle. What have other people done to get past that hurdle? And those are more of that sharing that was mentioned earlier, and that learning from one another, not reinventing the wheels, making that networking and collaboration happen among the sites. And the larger group meetings are really information sharing. Now, I would also add that we like to spotlight units that are doing great work in those large group meetings. So it'll be a topic driven, and then a spotlight of a group that's working on either that topic or have integrated those concepts in to where we also can help fuel that awareness of, hey, this group is working on blank topic and they are doing it this way. And that helps to that networking as well, because somebody in the audience might be, I'm doing the same thing. I'm going to call them after this. I'm going to email them. I'm going to reach out to them. So it's information sharing. It's also networking and hearing people ask the question that you had in your mind. And so it's a great way to mix those things together.
I really like the fact that the units can, learn from each other. And especially if somebody's struggling and they cannot come up with an idea of, I just don't know what to do anymore, up against a roadblock. And to hear from somebody else, I think is great. But I also like that you take a moment to spotlight units too, because I think that meets one of the healthy work environment standards of, meaningful recognition for what they're doing so well.
The only thing I would add is, I've been on several of these calls and it sounds a little odd, but intentionally even bringing the people that are working together on the projects at that local level together in a room seems silly, but we know how busy everyday practice can be. And just having the team members re-engage with each other in that, even if it's just 45 minutes of time, I think there's a lot, particularly when the interprofessional group is there, I think that is very meaningful as well, because then you have a lot of ears hearing the same message, and it could also trigger a lot of important discussions that occur even after the meeting, as opposed to just having one person there. So I think that was maybe unintentional, but a really great thing that's coming out of this.
Michelle, I think that's a really great point, because one of the like high points we just shared about why do a collaborative, and it does provide this structure or rhythm that gives you accountable milestones. And those monthly meetings are an accountable milestone, so that you're kind of forced, because of the schedule, it already is the time you're going to get together. And you don't have to force your team into coming up with a new time or what your rhythm is going to be or your frequency. It just marches you out together. So I think that's a really great point to highlight, Michelle.
I like
In
that.
any behavior change, accountability marks are key to driving the right outcome. So yeah, I agree with that. You alluded to a little bit of the interdisciplinary work, and the healthy work environment assessment tool that AACN's traditionally had has been RN focused. And with this program, we intentionally developed what we call a team tool, or an HWE. We call it the assessment tool HWE, but HWE team. So Michelle, can you talk about the decision to really move the focus a little bit from RN only to team-based?
Yeah, I think that was one of the smartest decisions the leadership team made at the beginning. And kudos, we haven't talked about all the people in the background that made this happen, and all of the tremendous amount of work. Vicki, you were part of it, obviously, but in planning the collaborative, again, thinking about that specific question. We knew early on that to make this really work and to really try to invoke change, that it would be important to call in our interprofessional teammates. We know we work closely every day with these different professions, and that they do affect our work environment. Nurses will never work in isolation. And so it does, and we often hear the reference about taking a village. I mean, these are people that we're encountering in our daily interactions, and that do influence the work and the work environment and how that's being done. So that decision, again, was really intentional, because they are a part of our team. And the work that nursing does, not all of it, right? Not all of our work involves interprofessional teams. There's a lot of intimate care that is just solely provided by nurses. But the importance of capturing that will give us an invaluable snapshot about how this collaborative does maybe possibly influence others' work as well. So again, we are specifically focusing on the nurses, but having that data on how the rest of the team is feeling and working, really super important.
Yeah, no, I couldn't agree with you more. I mean, it takes the whole team to take care of a patient, and that whole team is going to lead to what the work environment looks like. So it's incredibly important.
Definitely. And I know you've mentioned a few times, they work on projects. And so I'm curious if you could describe one or two of your favorite or most intriguing projects that you've heard of thus far, and how those teams integrate healthy work environment into that work.
I'm going to defer to my brilliant colleague for this because she's been intimately involved with a lot of the projects.
Well, I have a bunch of favorites, but I did put a little bit of thought into this beforehand, and I'm going to share two that I think are really great. Now, take one step back, and I think this dovetails on what we were just talking about, the interprofessional nature of the work that we do in all of our units in the hospital, right? Like we really cannot. No one can function, no one profession can function in the hospital alone. And so what we've been teaching these sites is we want you to look at your work through the lens of the healthy work environment. Like everything that you look at, we want you, when you look to the left and you need to work on a staffing issue, we want you to think through a lens of these 6 standards. When you look to the right and you got to fix a problem with infection rates, we want you to look through the lens. Are you checking the box of these 6 standards? So we said, pick a project, any project that you're working on in your units. It doesn't have to be a project about healthy work environment. We want you to pick a project and then look through this lens for that project about how can you, when you're thinking about this project, make sure that you're incorporating a healthy work environment so that the project thrives, right? We want it to, we want to work on the soil so the plant just grows like crazy. And otherwise, we're kind of pushing the ball uphill, trying to do a good thing in a bad environment. So in one of their units, this is our unit-based project, one of the things that we did in our activity, in different activities, was we did a SWOT analysis. And in that, strengths, weaknesses, opportunities, threats. And in that, they realized that, hey, our readmission rates are struggling. And one of the things that we could do to help, not necessarily struggling, but they wanted to improve them, right? Like, so how do we improve those? And one of the things that they said was, we're not getting the mobility that we need. We're lacking some of that baton passing between nursing and therapy and orders being written, and we need to work on that. That's their project. Is they're improving mobility in their unit, and so that patients will be ready for discharge in a way that prevents readmission. So sending the patients home in a more thriving way instead of limping, right? So that they just crump and come back to the hospital. And so they're doing this project, and they're putting on I call it put on your glasses, put on your HWE glasses, and they're putting on those glasses and saying, okay, do we have effective decision-making in this project? Do we have meaningful recognition in this project? And do we have authentic leadership in this project? Going through each one of the standards, looking at that project. And that's going to teach them, after this collaborative, not how to do a project on effective decision-making, but how to do any project through the lens of a healthy work environment. So we challenged all the hospitals to do a project that kind of spanned the 3 units, that's bigger than them, because guess what? Patients usually go from the ICU to a step down to the floor, or from the emergency department to surgery to the step down. So patients move through our hospital. And so we wanted to help take this idea to a higher level within that spans units. And they're working on workplace violence. And they have a trauma unit, and that trauma unit has a step down, and they've realized that for their staff, they've had lots of reports of workplace violence. So they're putting on their glasses and looking at that project they would have done anyways because they have a problem here that they want to address. They would have been working on this, but now they're working on it with some structure, some support, and a perspective of saying, hey, are we thinking about effective decision making and skilled communication? And how is that spanning these 3 units as we're looking through the lens of healthy work environment? Those are two of my favorites because they point out it's not a project about healthy work environment. The idea is how to look at anything in your unit through that lens and to say, after this, anything they do, they could look at it and they'll know to apply those same concepts.
And I would just reemphasize for the listeners that like those were 2 magnificent decisions I think that the leadership group made at the beginning. One was not picking a standard and emphasize, and that's the project that I'm going to work on. Rather looking at the project through all six of the standards. Huge, big decision that shouldn't be underestimated and is going to be one of the really unique contributions of this quality improvement collaborative, I think. And also we just briefly mentioned it, but that having the units doing their projects, but having that hospital-based project where the teams, because of that, again, the interprofessional aspect of it, but also that cross-sectional that, that our patients are traveling from unit to unit in the course of their hospitalization, again, was a brilliant decision to take a bigger look at different aspects that affect patients recovering during the hospital. So I just wanted to reemphasize those 2 points that Brenda brought up because they I think are really one of the most unique aspects of this particular collaborative.
And I agree, Michelle. I've consulted and done a lot of work with HWE standards in the past, and I've always encouraged teams to focus on one standard. And now I'm seeing the benefits of focusing on all of them. And I think, Brenda, you call it wallpaper the standards. So what tools have we given the teams to be able to be successful in applying standards across the board?
Well, I think it starts with a new language, right? So it's, talking about putting on the glasses, look through these lenses, that's my big joke phrase. I guess it's not a joke, but that all of our units should be wallpapered with these standards, right? So that whatever's happening there, that's the soil, right? Whatever's happening there thrives. We've all tried projects and had a lot of sour stuff around us going on, and that project fizzled and was just a waste of time. And nobody ended up benefiting, and we wasted time and resources and money. And started over a few years later when the sourness was away or better at least. And so I think that it's some of it is giving them tools of a language of how to teach this, how to talk about this, why healthy work environment is important, the why, and really equipping them with that language and that understanding, which is why I love those spotlight presentations, because they are for us sharing. Each unit or hospital, whoever spotlighted shares, but it gives them a practice opportunity to share, to talk about what they're doing, to be able to put it in a succinct way, because that's how wheels move in hospitals, is you got to be able to tell what you're doing. That's how you're going to get more resources. That's how you're going to stoke excitement, and how you're going to fan the flames of a project is to be able to talk about it and share about it. So I think some of the tools is giving them new language. Of course, we've got this education we're giving them, but we're giving them opportunity to practice. In fact, in April, they all are giving presentations, and we're having these long meetings where everybody is giving a presentation, and that's intentional. A little bit of that accountability that we talked about earlier. It's a marker. It's a midway marker. How are you doing? Share how you're doing. Hear everybody's projects, but it's also a practice opportunity because they should be able at this point to share about their project. And we've been giving them some different presentation tools, like teaching them driver diagrams and teaching about how to do an A3 model and teach these different quality improvement tools, giving it to them and then saying, here's how you use it. So here's the tool, and then here's how you use it. And here's one we want you to use in this presentation. So I want you to see it, learn it, and do it.
Love it.
That's great. I just love everything that these bedside nurses and non-nurses, but who are at the bedside are learning all of these things. Just going to make their practice that much more fruitful and their work environment as well. So, Michelle, all teams, they go through, norming, storming, and performing phases as they grow and solve their issues. Now, with the collaborative, I believe you said it's about halfway through the journey. So what kind of obstacles or storming issues has the team had to address, or have teams in general? Is there anything that's common or?
Boy, you're great with follow-up questions, because I was actually just going to mention that with follow up on Brenda. We are almost midpoint. Oh my goodness, did that go fast, right? Wow. All the incredible work that they've done today is after these really, I'm thinking this kind of midpoint check-in when they're doing these presentations that Brenda just described. We're going to be doing a little bit of a background checking too to see where our friends are. Are there people that might be struggling a little bit more than other groups? And then formally reaching out to them and saying to them, what can we help you with? What are the challenges that you're experiencing that might be impeding the progress? Maybe they started down one lane in terms of a project that they were going to focus on, and then a major catastrophe happened. Unfortunately, all the terrible stuff that we've been experiencing lately with the wildfires, and a really important part of this is going to be that touch base to see, because in any group, you're going to have a set of high performers. And, then you're going to have that normative group that's chugging along that, making slow, nice, steady progress. And then you'll have those people that might need a little bit more help. So there will be an intentional check-in for those groups that are experiencing challenges, and an intentional reach out again. What could we do that we're not doing that might help you? And it's okay. We know that not everybody will be able to finish the journey together. No, I don't think any collaborative, finishes with every single group that they started with. But we really want to give them the best chance of success. So that intentional check-in saying with their coaches saying, what's going on? What can we help you with? What's working well? What's not working as well? What could we do to get you through the second half is going to be really super important.
It's incredibly valuable learning, because, what we hope that whatever we learn in this collaborative, we always say whatever answers that we learn in an experience are incredibly valuable. So whatever we're learning along the way, because life happens, hospitals change, leadership change, there's leadership turnover, there are natural disasters, there's wacky things going on in all of our backgrounds, right? And when those things happen, what are we learning here? What are we going to be learning? And even in those questions that we ask of how could we help? What do you think could help? So that as hospitals, Vicki gave the major outcomes associated with improving healthy work environments. It's worth the investment. And as more hospitals invest in healthy work environment focus, what will they do? What we're going to be learning, what they'll need to know for units that start to struggle. How can they help a struggling unit? Because in a hospital, you're going to have high performers and you're going to have low performers. And what do you do in different settings? The emergency department is not the same as a post-surgical unit. They don't have all the same challenges and all the same staffs and all the same pressures, right? The pressures that are on them. And so I think that those types of things that we'll be learning from this group, we will be able to share. And that will be really beneficial to hospitals in the future, hospital systems, individual hospitals, as they face those same questions.
And this may be a little bit of an unfair question, but I know we're measuring the HWE assessment tool, so getting a measurement there. We're also doing the Maslach burnout inventory. And the teams are doing those measurements at periodic intervals. Do we have any glimpse of where that data is headed, what it's looking like?
Yeah, I would also add that we are collecting outcome measures as well. So those are self-reported measures. So of how they feel things are going, how they perceive their work environment, how they are reporting their feelings about burnout and workplace violence questions, but also in terms of readmission rates and hospital-acquired infection rates and nurse turnover and retention, all those types of measures. For the healthy work environment measures and the burnout measures, what we've seen so far is, and it's hard, we don't want to overinterpret, but we've had 2 cycles. So like Michelle mentioned earlier, we're about halfway. We've had a baseline and then a 6-month check-in in those surveys. They'll get resurveyed again in May, and that'll be a third check-in. But we've seen the numbers improve, incrementally improve. They haven't gone down, they've gone up a little, and we're just waiting to see what happens. And a big part of the new phase I think we're moving into is how do we sustain where we are? And that's till now we've been launching everybody into these ideas and launching these concepts and these tools. And the next round of tools is how can you go up a notch and how can you stay there? Even when there's other noise in life and you don't have a collaborative going on, how can you stay there?
That makes so much sense. And so I think to segue, when I think about results, Michelle, this question is really going to be directed towards you when it comes time to disseminate the findings, of the collaborative. Do you think, or could you give us a glimpse of how you see this work that's being done contributing to HWE science in general?
Absolutely. I think it's going to be the gift that keeps on giving from our past experience. I think we're going to learn a tremendous amount from the collaborative. Brenda mentioned some of the outcomes that we're following. I think there'll be a lot of unique things that we look at. We'll do the traditional dissemination. We're already thinking about, the 12 papers that we're going to be looking at and seeing, did the collaborative have an effect on a healthy work environment, right? Did partaking in the collaborative help them in their HWE scores, right? We looking at things of, the effect of the collaborative on different patient outcomes and really important nurse outcomes. But I think the dissemination is going to be also, there'll be multiple ways that we're doing that. Just these unique projects that they're doing, I think are going to be a really great contribution to the literature. Some people are being really creative in the strategies that they're taking. We'll have a nice, just knowing, like if you think about it, just knowing what these units are going to have focused on and what their projects were on is going to be a really great snapshot into what these individual units are thinking that it is the most important thing that they're facing in their practice. And we're going to get that from a variety of different units. I think that interprofessional focus also will be really, really important and a neat contribution to the literature. So I think dissemination is going to be multi-pronged, and I think that we are going to learn so much from this talented group.
Michelle, I love all that you share, and I agree. And I would just add that at 25 years ago, in 20 years ago, maybe when this was an early thing, and I was this brand new nurse, and I happened to be sitting in a volunteer weekend at AACN's board meeting, hearing about this new healthy work environment standard stuff, would have had no idea that all of this was going to happen. And one of the things in those early meetings, I remember people talking about BHAGs. So big, hairy, audacious goals, right?
Mm-hmm.
And so one of my BHAGs for this project is that we jump into multiple swim lanes. So right now, I think that HWE is really in the nursing world. And I think this collaborative and the data that we're going to have from it and the participation of all these different professions are going to help us disseminate this in multiple swim lanes. And so that This information gets to our physician colleagues more. This information gets to our respiratory therapy colleagues, to our surgical tech colleagues, into the labor and delivery population, into the pediatric population, into the adult ICUs. So really we have such diversity of specialties and professions involved in this collaborative that there's opportunity there for a real multiplication of a message. And I'm really excited about that.
Yeah, we're just elated and can't wait to see where this all goes and our outcomes. I wish I could speed the calendar up to next year so we could see what those outcomes are going to look like. Brenda and Michelle, it has been a tremendous honor and joy to spend time with you all today. I get to work with you every day on this project, but many of our audience, this is the first time for them to meet you. And I just appreciate you being able to share your expertise with our audience.
Thank you for having us. This is so fun. We love talking about this, right, Michelle?
And thank you, AACN, for doing this, one of the biggest, most important collaboratives ever. And it's going to be, again, the gift that keeps on giving. It's our pleasure to be here.
As we conclude our podcast, I know many of our listeners have not had the opportunity to participate in the collaborative. I just want to point you to where some resources are for our healthy work environment projects. If you go to aacn.org, click on Nursing Excellence. In the dropdown, there's a section for healthy work environments. You will find all sorts of resources to help you on your healthy work environment journey. And I also want to give a special thanks to our listeners for joining on this episode. We welcome your feedback for this episode or any ideas for future episodes at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's award-winning quarterly journal, AACN's Advanced Critical Care, with information available at www.aacn.org/advancedcc.